Okay, so let's begin. The faculty is the Faculty of Science and Health, and it belongs to a sub-school, which is the School of Dental Health and Care Professions. So this is a brand new program that we're offering, very much because we have had the experience of dental students for many years. We have NHS clinical experience as well. We work very closely with King's College London. So their students for their dentistry courses and their medical courses, their MBBS students come to Portsmouth to do clinical placements in our hospitals. So we do have quite a lot of high-tech equipment. I'll show you a bit more about that afterwards. Lots of different groups of healthcare professions working together. So there's interprofessional learning. So we have a school that has all of these students, medical students, nursing, pharmacy, radiography, and now the dental students. So they also learn from each other. And the graduate outcomes of our students, our graduates, is actually quite good as well. So we, as you can see at the bottom, it says we treat over 5,000 patients every year within the school. We do a lot of community-based placements. So they're in schools, they're in elderly care homes, it could be shelters. And we learn, as I mentioned earlier, a lot from each other within the interprofessional divisions. Our dental academy actually has more than 20 years track record. And we've had the GDC accreditation for some time. We, as I also mentioned, we partnered King's College back in 2010, and we provided placements for their students. So now we're doing this program for ourselves. So in 2026 September, we will have our first cohort for dental surgery students. And we're offering it to international students first. There are no home students on this cohort. We'll probably start recruiting for home students next year onwards. But these first few places are to some very special international students. So in terms of facilities, as you can see in a couple of images here, we have on-campus care clinics. So we have the treatment bays, we have the dental surgery equipment, imaging, printing, we have our radiography facilities, so X-ray facilities. So very, very similar to real world. Oh, they are actually what industry uses. And we also have phantom heads, training facilities, and simulators as well. The teaching style is blended, so there is both combined face-to-face teaching, some online learning, lots of problem-based and case-based learning, because we need to build the students' experience and knowledge on clinical reasoning. Hands-on training, so students have to practice dexterity of their fingers and hands for clinical skills. Live patient sessions right from the start of the course. And we have a buddy system. So for example, your year 1 students who are coming in fresh may be buddied by a year 3 student, for example. A year 2 student may be buddied by a year 4 student. So we have this buddy system ongoing with our healthcare courses. It's the same for other healthcare courses as well. Okay, the virtual learning platform is Moodle. That's quite common amongst UK universities. There are placement activities throughout the 5-year course. Now, Portsmouth is well known for practical programs. Even in our pharmacy course, which we are quite well known for, our placements start in year 1. That's unheard of in other universities. So similarly, in our dental program, we start our placements in year 1. So we start with clinical placements there. There are community outreach placements in year 2 and year 3. We do pediatric dental care, so young children, geriatric, so that's much older people, rehabilitation centers. Secondary care outreach is in year 3, 4, and 5. So these are special care for individuals who may have certain disabilities, and we also go into hospital settings. Okay. This is just a chart, a very, very general chart of how the credits are broken down across the 5 years. And it also goes to show that the holidays are shorter for the dental surgery students. So for example, a regular business student in a bachelor degree will probably have a 3-week winter and spring break. But the dental students will only get a 2-week break, right? So summer break also similar. It is also shorter. Okay, so the dates you can see there. Please bear in mind that if there are students who are still interested in coming in September 26, it is already considered quite late, but we can talk about that afterwards. But for future intakes like September 27, just bear in mind that we do not permit late registrations for healthcare courses. Same applies to other healthcare programs as well. So 13 September 27 is the next following year's intake. This is a slightly more detailed breakdown of the course structure. If you have any questions about this, then please feel free to ask, and I will try and get some information from the faculty. But as you can see, years 1, 2, and 3, it's about understanding clinical practice. Then there is about personal development and well-being across all 5 years. Patient care and deliberate practice is a little bit more advanced. So that's in 2, 3, 4, and 5. Oral diseases are in years 2 and 4. Okay, so outreach is across years 3, 4, and 5. Careers for dentists. Now, when students graduate, most students will think, do I want to go into the public sector or the private sector? Now, this degree, at the moment, because it's offered to international students in 2026, right now it's graduates are told that they can go into private sector only for now. So what is expected from NHS is one cohort to complete. So this cohort will finish 5 years later. That means 2031. 2031 is the time that the application will be completed for the foundation training option. So we'll apply to NHS for graduate placements so that students who graduate from our degree can then register for NHS after they do the 1-year foundation training. Okay, so usually when students study from a university, it's the same with pharmacy. They study the degree and then they have to go and work for 1 year, which we call foundation training. Whether they're doing pharmacists or whether they're doing dental surgery. When they complete the foundation training, they can then register with NHS for public sector. Okay, so we do not have this yet. It is on its way because we have to complete that one cohort first. But this is still an accredited degree, so students are still able to go out into private practice. And there are lots of positions that are open. If you just open social media, you will see how many organizations are trying to recruit dentists in the private sector at this time in the UK. So they can work in hospital dental services, in dental education, research, public health, and they can potentially progress further on into postgraduate specialism studies. Okay. Dentistry, no surprise, like medicine, is one of the UK's highest earning subject areas. Okay. They start high. During the foundation training, if they are going into the NHS, they start slightly lower, around £40,000 a year. And then when they finish the foundation training and get their registration, the NHS salaries jump at least £10,000. Private sector potential is very large. So it depends on the private organization and their requirements. So the employment rate for dental graduates is also very high. As you can see here, it's about 97%. So only about 2% report unemployment, but otherwise many go on into further specialist training also. So the dental foundation training is the 12 months work placement that is being worked on at the moment. So I mentioned this earlier. So this is a GDC accredited course, which allows students to be recognized for private sector work. Okay, but if they want to go into the public sector, then they will be eligible to apply for foundation training later on in 2031. Okay. So entry requirements for the BDS are English language, IELTS 7. Please bear in mind that GDC accredited courses only accept IELTS. They don't accept other English tests. We also need to see something equivalent to English or maths O-levels, grade A, and 2 sciences at grade B or higher. A-levels, so students are studying A-levels or IB, it's something equivalent to 144 UCAS points. So they must have biology and one other science subject. It could be chemistry or mathematics. Not so many students take physics, but if they have physics, then that's also a possibility. They should have some practical science experience if possible. That means they would have done maybe some experimentation in lab classes during their schools. We don't accept vocational A-levels or general study subjects. Students are also required to take the UCAT admissions test. Now, for this year, we have asked for special permission from UCAT so that students can take the test in July. Because we started promoting this course late, they can start making their bookings this month or next month, and the testing starts in July. So this is for September 2026 entry. But if they're applying for 2027 entry, please note that they should apply this year. Most students apply for UCAT 1 year in advance because UCAT will collect all the information, all the results, and send them to the universities in November of the year before the actual intake. It is only because this year is special that we are promoting it late, that UCAT is giving us some special places to take the test this July. Otherwise, students must follow the normal UCAT cycle, which is to take their test early. So if they're coming in 2027, they should also still take their tests in 2026. Students must pass health checks before starting the course. This will be done on campus. So the health checks will be done after the students register for the program. But it's good if, let's say, students already have some tests done at home, and also certificate of good conduct. If you have this service in South Korea, then please have the student bring that certificate or keep that certificate with them. Or if during application they want to submit it as well, that will also be useful. The DBS will also be checked when they're on campus. But it's very helpful to have the student bring this certificate along. In some countries, they get the certificate from the police. In some countries, they get it from their ministry, where they declare that the student has no criminal record or anything like that. So it's a certificate that certifies them of good conduct. Okay, so if they have this, please ask them to bring this along. The selection process is quite detailed, and I will show you the timeline in a chart afterwards. But generally, students can apply either through UCAS. If you think that UCAS is too complicated with the default deadlines, then please, by all means, they can apply through direct entry. Please bear in mind that personal statements are very important for any health course that students apply to. I will talk a little bit about this later, or if you have specific questions about personal statements, please let me know. There are certain guidelines, and we always tell students to go to the NHS website. So the NHS website will list its values. Students should understand what these values are, because in their personal statement, they will need to refer to some of these values and to explain how they relate to it, what drives them to want to become dentists in the future. So we also look at UCAT scores. We will interview the student. So if the student has passed the IELTS, please bear in mind that the IELTS score should be submitted at the same time that the application is submitted. Because for health courses, we do not process the application until we see an IELTS score. For other courses, business, technology, computing, anything, it's fine. We will process and then we can say subject to achieving IELTS. That's for other courses. But because healthcare courses are so limited in places, we must see the IELTS score first. So if we see IELTS 7, then we will give the student the opportunity to be interviewed. If we do not see the IELTS score, we will not invite them for an interview. Okay. So in the interview, they should be prepared as well to explain why it is that they want to become dentists. They may be asked about the NHS values as well and how it relates to them personally as an individual. So they need to prepare for that interview in that way also. So an offer can be given to them based on their personal statement, their interview, and their UCAT scores. If a student is unsuccessful, for example, if they did not pass something, maybe they were not asked for an interview, or maybe they did not pass an interview, we're happy to give them some feedback so that they understand and know what happened and where they can improve. So for personal statements, they should write about their motivation and commitment. They should preferably have some sort of dentistry-related work experience. So we're not saying go and work and earn a salary. We're saying if you have had any voluntary or even observation experience, that would be ideal. Because the students who are selected for interview usually have this. It applies to pharmacy, radiography, dentistry. the professional health-related programs. This is what the faculty usually likes to see. So that's why we're sharing it on this slide. So even if students do not get paid, they should probably try to volunteer to get some of this work experience. They should talk about teamwork, because within the professional work, healthcare work, it is always teamwork. And any other non-academic achievements that are related to healthcare that we might be interested in. They should talk about manual dexterity as well. Talk about how they have used their hands and fingers, what sort of activities they have used their hands in. And maybe demonstration of values, working in healthcare. Perhaps they have done, again, some voluntary work or shown how they have been caring individuals in society and how they have demonstrated this. Course fees. Oh, and why we say other universities. So our faculty did some homework and they compared our fees with other universities so that our agents can actually see for themselves how it works. So our fees at the moment are £43,000 per year. So it's quite a high fee. There is a merit scholarship for Korean students and a development scholarship as well in the first year. So this is not every year, but this is upon entry. So if a student has done well, there may be very limited merit scholarships because in the first instance, dentistry students should be good quality students, right? So there are probably more development scholarships available because that's automatic to Korean students in the first year. So instead of paying 43,000, they pay probably £41,500. There are some minor costs that students need to think about. Let's say some clinical clothing, badges, those visors that they use in the clinical setting. So small little things that they may need to cover during their course. So this is a chart. I think it's 2 slides. Yeah, it's 2 slides. So you can see, for example, for all the other universities that offer dentistry, where we are positioned. Okay. So see, for example, Birmingham is 28,000 in the first year, but then from years 2 to 5, it's £50,000. Newcastle, Bristol, it's 46, 48. So I think at the moment, the only one on this slide that's lower than us is Plymouth. And yeah, and it goes higher. So you can see Liverpool, Queen Mary, Leeds, Manchester, Kings, who's our partner, Sheffield. So Sheffield goes up to £91,000 from year 2 to 5. So that's really high. So that's an exceptionally high fee. And you can see the different types of admission tests that are conducted. So Plymouth and Portsmouth have UCAT and online. We have a panel interview. The rest, some have panel interviews as well. Bristol has a structured interview. The rest has FMMIs or panel interviews. But everybody needs a UCAT. So in summary, this is what the student goes through. Okay, so they look at their entry requirements. Do they have IELTS? Do they have high school scores, certificate? Then they submit their application. They either apply directly through an agent or through UCAS. They have to look at their personal statements, work experience, core values, and they need to do their UCAT test. The scores will be shared with all the universities, not just Portsmouth. If the student's applying only to Portsmouth, then it will be shared with us. If they're applying to several universities, it will be shared with the relevant universities. So if they pass all of this, then they'll be invited to an interview. If they pass an interview, we will give them an offer. Then if there are any pending conditions, such as a deposit or anything else that they need to show us, then they need to meet that before we issue a CAS. Okay, so this is the timeline for September. So just to give you an idea, some of the students are already doing their interviews, but we know that students will probably be later this year because of the UCAT availability. So potentially interviews may be delayed a little bit further into July or August. Probably not beyond July. August is actually quite late. So they should be probably meeting all their conditions by August and getting their CASs. The start date is 14th September, so hopefully students will make it on time if they're coming in September 26, and then they graduate in 2031. But if students are looking at September 2027, then they can start to apply much, much earlier. So in summary, at the moment, we have 10 places for international students. So we're busy looking for the 10 students now. It can go up to 20. So our faculty is open to doubling this number this year. Potentially by next year, we're looking at 50 students, but that includes home students as well. Right, so looks like we're at the end of this presentation. I'm just going to stop share here.